Greetings and welcome to In-Depth. I'm Dike Rostant. April is Women's Eye Health and Safety Month, where the focus lies on eye-related diseases that are more common in women. Now, women have a higher risk of developing certain eye diseases. Now, to speak to that, Surgical Services Manager at the Trinidad Eye Hospital, Prianka Persad, she joins us to discuss these points and more. Thank you so much for joining us, Ms. Persad. I'm wondering though, we hear different types of diseases affecting women a little more consistently. So, but even before we get to those, what are some of the common diseases that can affect women more than men, this is?
Sure. So a lot of women tend to experience more common conditions such as cataract development, glaucoma, dry eye disease, and even something more commonly known as refractive errors. We call it things like short-sightedness or nearsightedness. Something that can simply be treated by a trip to your optometrist for sunglasses or contact lenses.
And are there reasons for this? Because I'm thinking sometimes that women give so much to children before, during childbirth, raising children up. Is that something that has to deal with it, or what are some of the causes for that?
So, because we are women, we have so many hormones and a lot of hormonal fluctuations that cause us to have visual impairment. And it can also lead sometimes to blindness. So with these hormonal fluctuations, sometimes we see it more predominantly in pregnancy or during menopause. And that's a conversation that the doctors tend to have with the patient in more depth. But even with underlying health conditions such as diabetes or hypertension, we see these leading to a lot of visual impairment.
And it makes me want to start asking, though, should a woman who may have a family history of eye conditions, should they visit doctors specifically to see about their eyes, or is it a matter of general practitioners looking at the fact that you're talking about these hormonal fluctuations? So who do we address first?
So if it's specific to your eye, so if there's no other problem, then definitely to your eye care professional. So you can see your optometrist as your first point of reference. And if the optometrist notices some changes, the optometrist will then refer you to the ophthalmologist. But if there are underlying conditions, for example, pregnancy or hypertension, diabetes, then we may need to have multiple persons involved in your case. So you need to be managed with both your GP as well as your ophthalmologist. And yes, if there is a family history of any sort of eye condition, it is recommended that we get checked.
It also makes me want to ask, though, what are there other demographics that you see trends in? Is it regard to age, ethnicity? What are some of the other demographics? Does it affect people in certain age groups a little differently from others? What are your findings? What are some of the experiences that you have along those lines?
So yes, age is one factor. A lot of studies show that from the time we hit 40, we start developing changes in our eyes. So from there onward, we start seeing things like development of cataracts, which is very common and it is an age-related condition. There's also development of something called age-related macular degeneration, also glaucoma. And glaucoma is one of those conditions that is known to affect the African population largely. So some conditions do affect certain ethnicities more than others.
And what is the procedure? I see something is going on with me, or a woman sees something is going on with her eyes rather. And what is the first course of action? Is it that, okay, well, I need to go test it for glasses, or I need to go test to see whether or not I can do something to help Because I don't necessarily hear people talking about eye exercises or mitigating certain conditions. But what are those? Take me through some of those basic steps, thank you.
Sure. So the first minute of noticing something, you should think of going to have it checked. So the most common thing with eyes would be noticing a reduction or blur in your vision, or even something as simple as itching or redness on the eye. So if you notice something like that, you would want to have it checked because you don't want to have blurry vision today, and you leave it, and you leave it, and you continue leaving it, and then it eventually turns out to be something terrible, like, glaucoma or retinal detachment. And these are conditions that lead to blindness if they aren't treated. So if I could just draw reference to somebody that I saw in clinic, she actually came in. She did not have the funds to do her surgery at the time because she had cataracts and needed cataract surgery. Because she wanted to take care of her family. And so she waited, and it eventually became too late. And so she went blind, and we could not help her. So she saw it, but she didn't come in because she needed to use the funds elsewhere to take care of her family. So even though there may be situations where you have to take care of your family or pay these bills, sometimes you just have to prioritize your health.
And you were saying, and we've been speaking, and that that scenario has been jumping up in my mind for a while. It's so filled with the sense of responsibility that I am the person, and no man, I still seeing. I just need to bring the paper closer, move it a little further away from myself, so that money could do something else. It can do something else. I don't need it yet, but I didn't realize that cataract surgery is also, I don't necessarily say time bound, but there's a window of opportunity for you to address it.
Yeah, so cataract, it's an aging change. So it starts, and as we get older, it progresses. And if there are, again, underlying health conditions like diabetes, it can cause it to progress more rapidly. So as the cataracts get more dense, your vision will decrease even further. And there are some patients who've been waiting for whatever reason, but they've waited so long that they can't even see shadow because of the cataracts. Yes, if there are no other conditions, the cataract surgery can still be done and we can get them to see light again. But if there is a cataract with other underlying conditions, like, combined with glaucoma or something, I mean, there is still a chance that further damage can be done.
And we started off on the premise that there are certain diseases that would affect women's eyesight a little more consistently than men's. And do you have like statistics or averages, like 1 in 3? What are some of the numbers specifically that we're dealing with?
Yeah, so there are lots of studies that have been done. It's known widely that 2 out of 3 patients are women that are affected with some eye health condition. There are also other studies that show that about 65% of the patients with age-related macular degeneration are women. Another study said about 61% of patients with glaucoma are women. And the American Academy of Ophthalmology had reported that about 66% of patients with blindness are women. So it's more than half of almost everything.
And we'll give those numbers a little chance to sink in. We take a short break. We are speaking with the Surgical Services Manager at the Trinidad Eye Hospital, Prianka Persad. Stay with us. We'll return after this. Welcome back. We are speaking with Prianka Persad. We're speaking about eye health specifically for women because April is Women's Eye Health and Safety Month. And Ms. Persad, are there things that, or because we spoke about diabetes, hypertension, makes me want to ask, are there lifestyle factors that women can do to reduce the risk of eye diseases?
Yeah, so there's several lifestyle changes that we can make. Things that we don't really think about that much. So including exercise into your daily routine, or if not daily, at least weekly, try to get some exercise in, including your fruits and vegetables into your meals and getting your greens, your omega-3s. But other things like smoking, if you smoke, you want to stop smoking because smoking tends to increase your risk of developing cataract and also increases the risk of developing macular degeneration. And something as simple as wearing sunglasses to help with the preventing the UV rays from getting into the eye that much. So yeah, there are certain things that we can adopt to help to prevent the onset of eye condition.
Ms. Persad, are there eye exercises?
There are some eye exercises. There are lots online, but one simple thing that we tend to tell our patients is to follow the 20-20-20 rule. And that is essentially saying that every 20 minutes, we look at something 20 feet in the distance for 20 seconds. And it really just allows the eye to relax a little bit and be not looking at the screen in front of you all the time.
Again, in that screen is talking, does the screen matter? Because some people may say, okay, well, they think they're able to work a little better with looking at their phone or their eye or some tablet versus a desktop in front of them. So does the screen matter?
Yeah, so when we look at these screens, we tend to blink less. And we don't notice it, but we do. And so because we're blinking less, we tend to have less lubrication on the eye. And so the eyes become dry, you tend to feel gritty, and so you experience some dry symptoms there. So digital eye strain is a thing. So we try to get people to take some breaks in between, not look at the screen that much, also lubricate the eyes.
And looking at the fact that during the first half of the conversation, you spoke to some symptoms that we can sometimes not pay attention to. Please remind us, lay those out. What are some of those symptoms that are those indicators that, no, I need to go get this checked. I need to see what's going on with my eyesight, my vision.
Okay, I think we might be referring to when I said if you have blurry vision or redness or itching. So yes, if you have blurry vision, it could be a lot of things. It could simply be that your eyes are a bit dry, and having some blue in the vision is one of the symptoms of dry eye. So you might need to just have some lubricant to re-lubricate the eye. Or it could be something like cataract forming. And if it is a cataract, then you'd want to be considering surgery because there is no drug to save the eye from cataract, although there are some on the market. But surgery is the only treatment for cataract, as we know. So yeah, if there is some blurriness in your vision, you definitely want to get that checked.
And you spoke about hormonal fluctuations. What about the onset if someone is saying, okay, well, they're perimenopausal or the menopausal? Are there things that can be done proactively to say, okay, well, these hormones are where they're supposed to be it supplements, so just being attentive to it with women's eye health in mind?
Well, there are some suggestions that patients, women that are in the menopause phase can develop dry eye symptoms, and it tends to affect the hormones, that is, tend to affect the tear stability and tear production, and it increases the dry eyes and therefore increases the susceptibility to eye infections. So if there are any medication that is recommended, that would be a conversation for the patients to have with their doctor.
I like the fact that you're not trying to diagnose or give anybody anything over, as opposed to saying, okay, well, check the person that you would go to, your physician, your healthcare, your eye care professionals. But also we spoke about, and going back to that fluctuation, or even before hormonal fluctuation, are there any traits, genetic or otherwise, that would make certain women predisposed towards experiencing issues with their eyes or their vision?
Yeah, again, there are certain conditions that are hereditary. So if you come from a family with conditions such as glaucoma or certain retinal conditions or age-related macular degeneration, then you definitely need to be screened, so that the doctors can pick up if you have any changes appearing that might cause you to also develop the condition. Not everything we can treat. Some things might just have to be monitored. But if treatment is available, then you should definitely look to get it treated before it, turns out to be worse later on, and then you get it.
Now, sometimes when people hear the word screen and they've never been, that can be something that's a bit intimidating. So what is the screening process like for your eyes?
So it's very simple, to be honest. We ask the patients to come in. In our clinics, we do a dilated eye examination, which means we put some drops into the eye. It opens up the pupil so the doctors can see to the back of the eye. The doctors will do an examination of the front as well as the back of the eye, so that they can detect any changes occurring in either part of the eye. And then if treatment is warranted, we treat. The first step of treatment usually eye drops. So again, it's not that tricky.
And give us that contact information, please, because sometimes we can reach down to the end and then, oh shucks, I forget to ask them, how do people reach out to the eye hospital or Trinidad Eye Hospital?
Sure. So our phone number is 235-4834. And we can also be found on social media, Trinidad Eye Hospital.
All right, that sounds easy enough. Thank you so much. And just before we wrap up, Ms. Persad, advice to women on balancing general or overall health in addition to eye health specifically. What are some of the things that you'd suggest?
I would strongly suggest that women put themselves first. It might sound cliche, but they put a lot of emphasis on their families, on their kids, to make sure everybody's okay, and they just sort of take themselves for granted. And so I again speak based on the experiences we have in clinic, because a lot of the patients, a lot of females that we see are mothers, and they do not always have the best vision because they've been putting everything in front, And so now they come to a point where it becomes difficult for us to save or preserve the vision that they do have. So I'd say to incorporate regular eye checks into their routine, not just eye, but regular health checkups, so that if there is a condition on the eye, we get that treated so that it doesn't lead to impairments with the eyes. Yeah.
And thank you so much for that. And just for that reminder to women specifically and everyone in general, it's so difficult, if at all possible, to pour from an empty cup. So sometimes you have nothing else to give, but you're giving, and it's to the detriment of all involved. So with that, speaking of involvement, we want to thank you for sharing your time and insight. Prianka Persad, the Surgical Services Manager at the Trinidad Eye Hospital. Remind me of that number, is 235-4834?
Yeah.
All right, fabulous. Thank you so much once again, ma'am. And on behalf of the entire TTT News team, this has been In Depth with me, Dike Rostant. Thank you so much for joining.